The FDA just announced that low levels of a cancer-linked chemical have been found in samples of the heartburn medication Zantac. So if you're looking for an alternative to taking a daily medication for heartburn, Dr. Laura Grimmer of SSM Health Medical Group of St. Mary's Hospital is here this morning with a suggestion. And good morning to you. And you're talking about an innovative procedure here called LINX. Tell us about it.
Yeah, so it's a new procedure that can help with the treatment of heartburn or reflux disease. It's a small magnetic bracelet that we actually place around the bottom of the esophagus. This is what the little magnetic bracelet looks like. And it helps with keeping the acid in the stomach down so people don't get those bothersome symptoms of the acid coming up into their chest.
What are we talking about for downtime on this?
Usually people go home the same day as the procedure. They may be out of work for a few days because it is an anesthesia, so you do feel a bit tired afterwards, but really minimal downtime.
Who would be a candidate for this?
Most of my patients who have really good success that have had long-standing heartburn, so dealing with heartburn for 5, 10, 15 years, who are on daily medications for it.
What are some of the benefits of LINX?
Well, it gets folks off those medications. With that FDA announcement you were mentioning, and there have been other studies showing some issues with the medication, so it allows people to get off their medication and still have no heartburn symptoms.
Yeah, and this is pretty non-invasive as well, right?
Correct. It's a few small incisions on the abdomen to place the device, but it's a very, very easy surgery, very easy recovery.
Yeah, is this different from the standard surgery they have for GERD?
Yep, so the surgery that surgeons have been doing for 50 years is called a fundoplication. That's a lot more invasive and involves rearranging the stomach to make that sphincter muscle tighter. This is a much smaller surgery that accomplishes the same thing.
So at least maybe worth looking at that instead of doing the traditional surgery for those suffering with GERD?
There are a lot of patients who are scared of such a big surgery but aren't really satisfied with their symptom control and the medications, and that's the perfect person for this sort of procedure.
Yeah, absolutely. Is it just something you come in and ask your doctor about? Hey, I heard about this on the news. Am I a candidate for this?
Absolutely, absolutely. And they can give you a referral to come talk to me. I spend a lot of time with my patients really looking at each individual case to make sure it's the right option for them, but I'm happy to see anyone who feels like they want more information about it.
And the results for the LINX system, they've been fairly successful, right?
Absolutely. About 95% of patients are off all heartburn medications, all those Tums, Zantac, all that sort of stuff, and have no heartburn symptoms.
Is this something insurance would cover?
It varies by insurers, but most of the Missouri ones are covering it. We have to go through a process to get it approved, but most insurance companies are covering it.
It sounds like it's at least worth looking into for certain.
Absolutely.
All right, Dr. Laura Grimmer, thank you so much for your time this morning. We appreciate it. And for more information on LINX, you can go to fox2now.com or our Fox 2 St. Louis app. Randy?